So my talk is going to be focused on how children's advocacy centers and Culture Reframed, kind of how that it all started for us, and what work we are doing to continue working together. And I'm hoping that we have many people in the audience today who are working at or familiar with children's advocacy centers, but I do want to take a moment to just give a brief overview of what a CAC is, just for those of you that may not know. And children's advocacy centers serve children and adolescents that are really believed to be victims of abuse. And so many times they're walking through the doors of a CAC right after they may have recently disclosed to somebody that has been then reported to investigators. Sexual abuse is the most common type of abuse that we work with and investigate, but we also do domestic violence, witness to violence cases, and other types of abuse and neglect cases. So I think that really one of the biggest strengths and greatest opportunities that CACs offer for those of us who work for them is the ability to work with and communicate with multidisciplinary team members, such as law enforcement and child welfare professionals, prosecuting attorneys, and also agencies that serve victims of domestic violence and sexual assault. And I know that for me, that was one of the best, things that I got out of my work and my almost 10 years as a clinician at a children's advocacy center. And it's also why I think the work and the partnerships that we are doing with Culture Reframed are so important, because we have the ability to communicate with all these different team members and support their work, and they support ours. So I just wanted to share some quick statistics this is from the National Children's Alliance. And so right now, the most current number we have are that there are 939 children's advocacy centers throughout the United States and abroad. I saw that there are some members, some people attending today from the UK, and I know that there are some CAC models in the United Kingdom as well. There's 386 191 children served at children's advocacy centers the last year, and we have almost 3 million people trained in child abuse prevention by children's advocacy centers. So we're really proud of that work. I was able to pull some 2022 stats just to get you a sense of Children's Advocacy Center reach. And in terms of accredited sites that the National Children's Alliance works with, we are looking at over 380,000 children and youth served. And there's usually up to 18, and many times we also work with vulnerable adults. We have, as you can see, there's definitely more females to male ratio of the gender of the children, and then there's undisclosed gender as far as how children may identify. And that's not surprising. That's really consistent with statistics that we look at for victims of abuse. And the types of abuse that are reported to CACs, and this is the data that we collect, we look at sexual abuse, physical abuse, neglect, witness to violence, and drug endangerment. And one of the things that I think we're really curious about in our work together, I think Culture Reframed and the CAC people that are working with Culture Reframed, is really, what about that other piece, 27,000 children? And does that also include children that have been exposed to pornography? And then this data is great, but then there's lots of data we just don't know yet. And do we consider exposure to pornography a type of abuse when it's used as a grooming tool? I know in theory we do, right? But how are we capturing that at children's advocacy centers? And are we able to capture that? What can we do about that? Where do we capture that? And so some of the questions that have come up for CACs that I have talked to are just, how can we better understand how children's exposure to pornography intersects with different types of abuse we see at children's advocacy centers? For some, sexual abuse may trigger curiosity about sex and lead to them viewing pornography to help them make sense of what happened to them, okay? For others, online porn was used as a grooming tool by their abusers. So I think that, one of the things we're always talking about in our work together and in the work groups is how can we, really learn to identify and collect data so that we have more information about the children we serve at children's advocacy centers related to this issue. So I wanted to just tell you a little bit about how I got here into this place of understanding and being, I would say, very much a super fan girl of Culture Reframed. And, my understanding, and I think some of you will probably, this will resonate with you. I'm a Gen Xer, so I'm not a boomer, but I'm a Gen Xer. And there are things that I definitely was out of touch with when trying to understand this issue. And my exposure and understanding of pornography really stemmed from, growing up and looking at those, that cable channel that was in the wavy lines when you're turning the channels and you have cable and you see, there's something going on there. And I remember my brother and I trying to see through the lines and understand, okay, so we knew that was adult. We could hear sounds coming. We could hear that. And then as I got older, we had video, places where you would get VHS tapes at the time. And then we had DVDs where there was a private room, right, where adults could go in to buy adult videos, right? And so, that was kind of how I grew up learning. And then, watching Friends when I was in my 20s, and they talked about, Joey and Chandler watching pornography. And you hear about that, you see it sometimes, but it certainly wasn't something that was front and center in my understanding and viewing at that time growing up. And so when I first started working at a children's advocacy center, my context to really understanding exposure to pornography was related to how it was used in grooming of children. And I really continue to think about it still as an adult controlled medium, right? In the sense that children primarily accessed it through an adult showing them things, right? Showing them something online, showing them something on their phones. And, I first kind of heard about free access public porn sites on an NPR news story, okay? And there was no real mention of how easy it was for anyone to access those sites at the time. And I started working at a CAC in 2011. So it's kind of where the boom and all of the access and social media and just access that children started having really started. And, one morning I had a 5-year-old client whose parent called me in a panic because she had found her 5-year-old daughter, who had been a victim of sexual abuse. The person who had abused her had not shown her online videos, but through just having an iPad that was just used for YouTube videos, that was the kids' YouTube, she had been able to click through different images and things and got on porn sites and had been watching pornography, a 5-year-old girl. And some of you, this may not be a big surprise, right? You probably are very familiar with this, but I know that I was pretty shocked. The parent was beside themselves. And I knew I was at a loss of even what to tell them, what to say, how to give them support, right? In how do you talk to a 5-year-old about this, right? And these cases, I started getting more and more cases like this. But I still was working from a reactionary stance in how I approached this issue. Waited until you found out about it, thinking about it, and then coming up with some patchwork way of trying to support parents, right? And, I've come to understand, obviously, how you can access these sites with extremely little work or understanding of what you're going to see, how you're going to see it. And there's virtually no barriers to accessing this type of content online anymore. I was completely shocked and surprised about that. And I didn't know what to tell people, children, adolescents I worked with. I started asking questions. I started asking the kids that I saw, have you ever had access to this? And so many of them, oh yeah, teenagers, younger kids, their friends would show them things, they would see things, and it was commonplace. No more looking through the blurry lines on TV, right? You could find hardcore pornographic videos by just a click. And it was completely easy, no matter how old, as long as you knew how to use the internet, you could access these things. And I know that I'm preaching to the choir, to everyone at Culture Reframed. But I think what really surprised me was just how I didn't think about this so much, even working at a children's advocacy center. So I was lucky enough to just I first came across Dr. Dimes by being I was part of a youth with, sexual abuse journal club, and she came to talk to this virtually to us. And I was completely blown away by this information. And it really impacted my understanding moving forward. And I definitely checked out the website, saw the educational materials online for parents, just got so excited about it. And, I don't know, Gail, if you remember the email that I sent you, but I sent this long email and I kept reading over it, just hoping that you'd be interested and your group would be interested in coming to speak at a conference for Children's Advocacy Centers of Michigan. And so our collaborations kind of started from there. All right, I'm going to share back. So for me, this really kind of started a whole paradigm shift of how I was thinking about things at the chapter level for CACs, how I know many of the people that went to presentations in Michigan for Culture Reframed, how we started thinking about this issue. And the definition of a paradigm shift is a fundamental change in approach or underlying assumptions. And at CACs, as we said, we're very familiar with crimes related to child sexual abuse materials and exploitation even, okay? But, I know I didn't even think about how at the early stages of my time at a CAC about youth access and exposure to adult porn sites and how that might impact the brain development, the socialization of the kids that we see especially. And so we don't really, and it's not an issue that we're taught about at Children's Advocacy Centers. And it's not brought up a lot. And some of it is because I think so many of us were, kind of socialized to not really think too much about the impact of adult pornography and viewing of it by adults, right? So and it could also come off as being a bit defensive when we think about those things. I grew up seeing this stuff. It's not gonna, why should it be a problem? And so we'd have to look at ourselves too when we think about this issue, and that's not easy. And so, I talked a little bit earlier about how, we talked about grooming, but what I really came to understand was how these sites in and of themselves can groom children without any adult controlling their access. And that's something I think that's really important for us to understand, is that how many more children become vulnerable to abuse due to this exposure? And how does that impact the children and the youth that we serve at Children's Advocacy Centers? Something that I think we're all really curious about. I found this slide, which I really like, and it's really, I think it's from NASA's, where I think we found the original thing, but to me, it just really exemplifies a lot of work we do about anything, right? Things we know, the things we don't know, we know. And it just reminds me of the great opportunities we have to work together. I think that Culture Reframed has been so wonderful, and the staff there of asking us questions about what they really didn't know about our work and who we reached and who we talk with and how we do our work, forensic interviewing, for example. And they have been so generous in sharing any and all information with us about the things we may not know, about the research, about the impact. And I think that it allows us to also have that space of the things that we don't know, right? To even think about those things together. So when we talk about our work and working together, we have a large work group and some smaller work groups where people that are representative of multidisciplinary teams, people that are working at CACs, where we really started our work together. And how I think that this work intersects, and I'm sure that other members of Culture Reframed will be talking about this throughout today, is really there's a lot of areas. So Culture Reframed has done amazing work in sexual education curriculum, in parent education curriculum. And so I see, to me, how we can work together when we're trying to figure out and develop materials to give therapists and advocates who work at Children's Advocacy Centers information to give parents. They've done the heavy lifting for us in terms of data and research and created these materials. And so really us working together and continuing to do that. Being able to utilize some of their stuff for our prevention work, because there's a connection between sexual abuse, prevention and exposure to pornography. We need to be thinking about that. And so these materials give us ways to also educate about digital literacy and things like that. So there's great opportunities there. Training for staff and multidisciplinary team members is something else that we're working on. So understanding what we do at CACs for Culture Reframed and how we can really target that work to talk to physicians that work on our team, that do sexual abuse exams. So we can talk to law enforcement, so we can talk to child welfare professionals. So all of these people, we're on the same page of understanding and having really a common language to be able to talk to others about this. It's really important. And I know that CACs around the country have really been excited about having access to this information. So, in developing resources. So those are the things that I think we're really the most excited about. But I also think there's other things that we can do moving forward. So when we think about where we can go working together, a lot of that's going to be talked about today by wonderful professionals and experts in the field. But developing those training supports and resources. But I think what I'd really like to see, and one of the things that we've been talking about with CACs, is really thinking about how we collect data at children's advocacy centers, some of the questions we're asking, making it part of a clinical intake, just like I'm asking, when I would do a clinical intake of a child at a children's advocacy center as a therapist, I'd ask about medical issues that they have. I'd ask about sleep issues that they had, because that could be related to trauma. It's, what if it just becomes a standard question we ask? Have you had exposure? Has your child has exposure to pornography? Asking the child if they've seen images. And we don't, they may say no, fine. But getting that information is going to be so helpful for us in understanding how it may intersect with many areas of our work. And so I think that's something that we can think about. And also collaboration on research projects, getting more data and research about the children that are served at children's advocacy centers. And that's starting already. And just continuing that collaboration, I think, is going to be critical in really helping children. So I think I did real. I'm even a little bit ahead. It's always good to be ahead of time. But I just, want to say that I'm very excited about the presentations today and to continue the work with all the great professionals who have come together to develop education and trainings, for CACs, for other, multidisciplinary team members, and that just thinking about this work and how important it is and how we, I love Mr. Rogers, of course. It's never wrong to have a quote from Mr. Rogers, but just thinking about how we're, I think we're both different types of fields at Culture Reframed, the people working there at children's advocacy centers and multidisciplinary teams. So we're really trying to take responsibility to protect children and youth in our community. And it's such critical work. So I hope that that will continue. And I'm very honored to be part of that process now. Thank you.